So I'm Sandra Carlson, I'm the Flu Tracking Manager for Australia. There we go. So I'm going to share with you the Australian experience of monitoring COVID with the flu tracking surveillance system. So Flu Tracking Australia is based in Newcastle on the southeast coast of Australia. So it's a community-based flu and COVID-like illness-based surveillance system. Just not moving to the next slide. Here we go. With over 70,000 participants in Australia each week in 2021 and 2022, the surveys are quite quick, which is part of its success, less than 30 seconds to complete. And in Australia, we have data since 2006. So how it works is every Monday morning, we send out around 50,000 emails in Australia alone, and we ask people and their household members to report on the prior Monday to Sunday illness period. So we get around 55,000 responses in the first 24 hours, allowing a rapid analysis every Tuesday morning. And this is what the questions look like each week. So we have 7 different symptoms: COVID and flu testing behaviour, COVID and flu vaccination, as well as severity of illness, so health-seeking behaviour and time off work or normal duties. So we collect data from participants, but we also give back to participants, and some examples of how we do this are here. So when participants finish their surveys, they receive a link to an interactive map, which participants love. Weekly reports, we share links to videos, post about frequently asked questions, sharing newsletters. We do infographics at the end of the season, and I can't emphasise enough the importance of the participant emails because they give us valuable information. So I mentioned that flu tracking commenced in 2006 in Australia. And as Craig has already mentioned, we expanded to New Zealand in 2018 with around 45,000 surveys each week now. Hong Kong joined in late 2020, and that survey is run in English and traditional Chinese, and Argentina joined just this year, and that survey is also run in Spanish only. Now, I was asked to comment on the timeframe to convert flu tracking into a COVID-like illness tool, but it was really an iterative process, as you can see from this diagram here, starting in early February. We added new symptoms, testing questions, we removed the nesting of symptoms and from underneath fever and cough. We tested a none of the above option to try and make the survey more efficient. So we did a split test on 1 in 8 participants. Most recently, we've added rapid antigen tests, and we're continually evolving it, adding vaccination questions as well. So we didn't always get it right. You can see here, these are the original respiratory virus testing questions we asked. And we were underestimating the percent of people who were reporting having a flu test because they were only reporting for COVID, or they didn't know if they were tested for flu. So we had to redesign these questions to the ones on the right. So we were explicitly asking about flu testing. So that worked well, but what it meant is we actually lost some data that we couldn't use that data from prior to May 2020. So that was a lesson learned. So just sharing with you some data from Australia and COVID. So these are the weekly confirmed cases. And in Australia, we had really low cases even during the Delta wave, right up until January 2022 when Omicron BA1 hit. And if you overlay the flu tracking fever and cough data here, you can see that the timing of the peaks of the flu tracking fever and cough data really align well with the peaks in the confirmed cases. But an interesting insight from flu tracking was if you focus in on January to April 2022, when we had little other respiratory illness virus activity happening, that peak in January for the confirmed cases was higher than April, whereas the reverse was true for flu tracking. So that was an interesting insight and perhaps alluding to some underreporting in the confirmed cases. Another interesting insight, as Craig has already mentioned, that in Australia, everyone who had even the slightest sniffle was asked to be tested for COVID. And we found in flu tracking, for people with new fever and cough symptoms back in 2021, only 50 to 60% were being tested until the rapid antigen tests were being introduced, and around 90% were being tested for COVID. And we also had an insight into the flu testing behaviour in 2022. So our cases shot up rapidly in Australia around April, May. And flu tracking was able to show that part of that was influenced by an increase in testing. And just looking at our participation data, so we've had a steady increase in participation from 2006 onwards, but it really shot up in Australia in 2020. And as Craig mentioned, we just had the Deputy Chief Health Officer promote flu tracking in a press conference, getting 20,000 people in 1 week. But as you can see in the graph on the right, participation is starting to decline with a bit of survey fatigue. So we're offering participants this summer opt-out option, and we've just done that for 2022 as well to try and give participants a bit of a break but keep a bit of a cohort going. So we do plan to continue monitoring COVID in the system. We're going to try and be as adaptive and responsive as possible. We don't have any plans at the moment to reduce questions, but we would like to revert back to seasonal participation when we can. And we don't currently have any plans to expand to other diseases at the moment, but we do have functionality in the system to do this, which we've used in the past for bushfire symptom surveys and thunderstorm asthma. And finally, we are hoping to expand to 2 Pacific Island countries in the next 2 years. So a big thank you to our loyal flu trackers, the flu tracking team, so Craig, Ali Kerr and Tom McKenzie, our applications developer Stephen Clark and the Australian Government Department of Health for sponsoring us. Thank you.